Hello, my name is Keely Russ, and I am an MSN student at Eastern Kentucky University in the Department of Baccalaureate and Graduate Nursing. And today I'm presenting a project to you that is implementing trauma-focused cognitive behavioral therapy among adolescents. A study of 4,549 children ages 0 to 17.2 revealed that 60.9% had experienced trauma in the past year. And mental health and overall health deterioration after a traumatic event needs to be addressed as early as possible to attain highest quality of life. So, the commonality of this problem just explains that there needs to be some type of intervention that is successful and that's efficient and that can be helpful to these children and adolescents who have experienced trauma so that they can have the best life possible in their adolescence and also carry on into their adult life. So, as far as background and significance goes for TFCBT, trauma-focused cognitive behavioral therapy is a treatment for children and adolescents impacted by trauma and also includes their parents or caregivers. All studies that were analyzed for this project found TFCBT to be a superior intervention for traumatized adolescents. And Healthy People 2020 has established the overall health of adolescents to be a top priority of health objectives for the United States, which means that as advanced practice nurses and all other healthcare professionals, the health of adolescents is a priority for us as well. If it's something that our country finds important, then it's something that we also need to address. And unaddressed traumatic experience can cause overall health deterioration throughout the lifespan. So this means that we need to pay special attention to this particular problem. Objectives for this project include providing traumatized adolescents with the best intervention to decrease or eliminate post-traumatic symptoms, and also to improve the overall health of adolescents by improving their mental health. Relevant literature that was found to back up the utilization of TFCBT in this project includes 4 different studies that I analyzed. All of them showed success with TFCBT usage. 3 of the studies were actually in other countries, and they all showed impressive improvement in PTS symptoms. This tells me that TFCBT is an intervention that can be used across different cultures. In the United States, we're going to also see different cultures that we're going to care for as advanced practice nurses. So the fact that it is used in other countries is very exciting to me to know that I could also use this with other cultures in my practice. There was also a very diverse representation of severities of traumas. For example, there was a study by McMullen, O'Callahan, Shannon Black, and Eakin that was in the DR Congo and included only boys who had been involved in a war. And this shows a very severe representation of trauma, and there were also less severe representations of trauma. For example, some of the other studies did not allow certain severities of traumas to be included, which meant that they had milder traumas involved. Jensen et al. Also found that the earlier the intervention, the better the outcome was for TFCBT. Methods for this project begin with recruitment of 13 to 18-year-old traumatized patients that are already seeking treatment at a local mental health clinic. And at their appointment at the clinic, they will be invited by flyer to participate in a comprehensive screening to determine their eligibility for completion in the project. With parental consent and the child's assent, they will attend 12 to 15 weekly hour-long appointments for delivery of TFCBT by a trained therapist in TFCBT. The Child Post-Traumatic Stress Disorder Symptom Scale, or CPSS, will be utilized to determine the success of TFCBT, comparing the beginning score with therapy ending score. And then at the end will be analysis by the primary investigator when all therapy is complete to determine the overall success of TFCBT in this project. And you will see in the very middle of the poster is the project timeline that includes each step of the project process. And the outcome measures of this project will include the Child Post-Traumatic Stress Disorder Symptom Scale, or CPSS, which is a self-report 4-point questionnaire that reveals higher scores, meaning more severe or more post-traumatic symptoms. So the therapist will administer the CPSS at the very first appointment before a session begins, and upon completion of all sessions to compare the beginning score to the end to know if post-traumatic stress symptoms were eliminated or if they were decreased. In conclusion, TFCBT is hypothesized to demonstrate success in greatly reducing or even eliminating post-traumatic stress symptoms in this particular project. The studies all represented outpatient and international success with TFCBT, so I'm very hopeful that there is also success in this project. If you have any questions, please feel free to email me at keely_russ3@mymail.eku.edu. If you have any questions, comments, or suggestions on implementing this project, and I hope you all have a wonderful day.